Hi, it's Jack Hartley, and I'm just following up on my last video about Parkinson's. I want to give you a little bit more information on it. So let's find out who gets Parkinson's. The average age that people get Parkinson's is 62, but people over 60 only have a 2 to 4% chance of getting the disease. Having a family member with Parkinson's slightly increases your risk, and men are more likely to get Parkinson's as women. So what causes Parkinson's? It's a small area in the brainstem called the substantia nigra controls movement. In Parkinson's disease, cells in the substantia nigra stop making dopamine, a brain chemical that helps nerve cells communicate. So once that stops making the dopamine, that's when you generally get the symptoms of Parkinson. Stages of Parkinson's is progressive, which means it continues to change inside your brain over time. Doctors measure the stages by using a careful assessment of your symptoms. The Unified Parkinson's Disease Rating Scale evaluates mental clarity and function and behavior and mood and activities of daily living and movement. Staging can help the doctor determine the best treatment. So what are a couple of the most prescribed drugs? One is levodopa, which is a drug that the brain converts into dopamine. It's been around since the 1970s and still the most effective Parkinson medication. Agnostis is a drug that mimics dopamine and is called a dopamine agonist, which may be used to delay the movement and related symptoms of Parkinson's. You can also have surgery, a thing called deep brain stimulation. Electrodes can be implanted into one of the 3 areas of the brain. A pulse generator goes into the chest near the collarbone, and the electric pulses stimulate the brain to help reduce the patient's rigidity, tremors, and bradykinesia. So what else can you do to possibly prevent Parkinson's? One is have a good diet. It's important to have a well-balanced diet with calcium and vitamin D for bone strength. So can the symptoms be prevented? There's not a whole lot that says you can, but coffee drinkers and smokers may actually be at a lower risk of developing Parkinson's, although smoking is an obvious health hazard. So what about Parkinson's and exercise? Well, exercise may have a protective effect, helping the brain to use dopamine more effectively. So it also helps improve coordination, balance, gait, and tremor. So if you do have Parkinson's, a little exercise goes a long way. What about living with Parkinson's? Parkinson's affects many aspects of the daily life, but with medications and changes to your life, you can remain active. Medication can help you cope with the mood disorders, such as depression and anxiety. An occupational therapist can provide a home safety evaluation. You may need to remove things that you could trip on, such as throw rugs, cords, and add grab bars in the bathroom for more stability. A speech therapist can also help you with swallowing and speech problems. I hope this gives you a little bit more information about Parkinson's. If you need to know more, please give me a call, 229-563-5123, or jack.hartley@homestead.com. Thanks.